Tight muscles around the hip is very likely a common complaint that people hear when paired with sciatica. However, that may not be the underlying issue. An underlying issue of sciatica may be caused by either a disc bulge or herniation. Now this is a lateral bulge, it's not hitting the nerve. However, a disc bulge or herniation can hit the sciatic nerve. Remember, that nerve comes from the low back and also down and from the sacrum. This is a better photo showing that that disc bulge or herniation is actually pushing back and towards the spinal cord and those spinal nerves. This can cause or create that sciatica-like symptom. Remember, radiating discomfort going from the hip or low back down into the knee on that side. Another form is actually what we call spinal stenosis, and that is calcification of the canal itself where your spinal cord should be going through, or a nearby area where the spinal nerves are coming out. So that's called encroachment. I'm going to show you that in a little bit. So no matter what it comes down to, you need to find the underlying issue that is causing sciatica. This is foraminal encroachment, as I just mentioned, another common symptom. And what's happening is those discs that are mostly water are starting to degenerate or lose their hydration, and it's actually shrinking that space where otherwise those nerves should be coming out of. What's creating or happening then is those bones or joints are collapsing in, creating a smaller space for that nerve to come through. That is also a possible source of sciatica. This is the red flag I have to mention, because if I don't, I'm gonna feel awful. This is called cauda-equina syndrome. It's a disc bulge or herniation or some type of stenotic action that is actually pressing into and pushing through the spinal cord. This is not good. The most common symptom that we see with this is actually a loss of bladder or bowel function. So if that ever happens to you, that is a red flag. You gotta go make sure that you're seeking out emergency care, because ultimately that can cause some debilitating issues for the rest of your life. So if you ever experience that, you gotta go in right away. Okay, now that I scared you, I'm actually gonna show you 3 simple exercises you can do. Because again, the most common though is actually some type of local imbalance and tightness of the muscles. So hopefully this helps. However, if you're ever having continuing issues, it lets you know there's an underlying issue that needs to be, number 1, identified, number 2, properly addressed. So again, my name is Dr. Greg. Hope you enjoyed these 3 exercises. Follow along for more. I would love to deliver more content to you.